Hello everyone, I'm Dr. Deanna Minich, and I want to tell you about the seminar that I'll be doing on cancer for Amipro in South Africa in June of 2014. What we know is that cancer affects so many people. If you haven't been affected by it personally, I'm sure that somebody you know has had cancer. The world rates of cancer have escalated. It's clearly an epidemic, and many people don't know what to do about it. If we look at the world statistics on cancer in 2012, 14.1 million people had cancer. It's been projected that that number will increase to 24 million in 2035. So quite a jump. So you as healthcare professionals need to be equipped with the tools that you need to help patients both prevent and treat cancer. And some of the biggest cancers are lung, breast, and colorectal cancer. All these cancers are preventable with lifestyle medicine. So what we'll talk about in the seminar is a personalized medicine approach through the functional medicine lens of how to work with cancer, looking at the spectrum, whether it's cancer prevention or cancer treatment. So the seminar will be broken out into 4 sections. In the first hour and a half, we will talk more about the mechanisms of cancer. We'll address things like the 7 different facets of why people get cancer and talk about things like genomic stability, inflammation, gut permeability, metabolic issues, and even hormone metabolism. In the second segment of the seminar, we'll focus on the 7 therapeutic essentials. So what I believe is that we have to take a full spectrum approach to dealing with chronic disease. So we are going to look at the many different facets to how you can work with people with cancer. So we will do a deep drill into nutrition and supplements specifically. So I will convey to you the latest science on nutrition and supplements, and then we'll talk about how to employ these modalities within your patient population. In the third segment, we'll cover the assessment and plan for cancer prevention. This is exciting because we can actually have a nutrition lifestyle plan that is core for everybody. So it's a core protocol, something that's easy to follow, and then from there we can tweak and look at the different types of cancers and the different things that we might need to do differently. And then finally, in the last phase of the seminar, we'll discuss the assessment and plan for cancer treatment. So when somebody is going through cancer treatment, what are the things that you do? And you know as well as I do that this is probably the most controversial portion of therapy, that there are different views about that. So what do we do as it relates to nutrition? Do we give antioxidant supplementation? What about multivitamin mineral supplementation? Omega-3s, folic acid? There are debates and controversy about all of these. So we're going to tackle those head on. And we're also going to talk about the big elephant in the room, soy. So join me this June for the Amipro seminar on cancer, covering as much ground as we can within that full packed day of information and hopefully inspiration so that you can help your patients do their best. See you then.